I'm on my way to my consultation with Dr. Kimberly Henry in Davis. It was supposed to be at 4, but she asked me a couple hours ago if I can come in a little early at 3:30. So I'm supposed to be there at 3:30, but it is currently 3:35. I'm running like 10 minutes late. I hope she doesn't mind too much because I'm coming in early anyways. But we'll see. I just came back from Sacramento, this cute little boutique that just opened up. They have these really cute little Mexican, Hispanic, whatever you want to call it, outfits, and like the really cute chanclas, which I've been looking for some forever. For me and Andre, I've been really wanting some matching ones. They unfortunately didn't have any matching ones for the both of us, but I still got some really cute ones. And I'm definitely going to go back. The store owner was super sweet, like incredibly sweet. And that's actually the reason why I'm late, is we kind of got caught up in conversation. And then on top of that, the address that was originally posted for the boutique on Twitter was wrong. She was telling me her daughter posted it wrong. So that's why I was late. I was kind of going in like circles looking for it. And she doesn't have a big sign outside yet showing the name of the store. So yeah. In regards to the consultation, I'm actually not nervous. I actually had a consultation last year with a different surgeon in the Sacramento area. So I'm kind of already expecting everything I'm going to hear and kind of already know. It's just a matter of hearing more about the butt implants, because last year originally when I had the consultation, it was just for the Brazilian butt lift. The surgeon I went to only does BBLs. He does not do implants, nor does he recommend them. So it was actually really difficult for me to find someone in the area that does butt implants, just to hear more about it and have my options open. Filling out paperwork, authorizations, consents, stuff about my medical history, because they do obviously need to know if you have any pre-existing conditions. So cute. And there's like a computer with a bunch of her previous patients and the work she's done. Give me a little pet. Okay, so they have put me in a room. I'm just waiting for the doctor to come talk to me. Okay, sorry, I sneezed like 6 times, so I had to stop recording. But I am going through with the appointment. Now, I did put down my $1,000 deposit, which is required when you do schedule an appointment and you find that you want to go through with it. So I put that down. I got my surgery date for the end of May. I originally really wanted to get my surgery done before my 21st birthday, because I do plan on going to Mexico, so I wanted to look bomb. But it's not happening, just because you need 6 weeks to recover, and in order to meet that 6-week requirement, I would have to get my surgery next week. And not only does she not have like the space for that, she's basically booked up, but that's just kind of hectic for me, trying to, you know, plan workout, plan my son out, plan just everything out within the whole next week. Like, that's just not something I want to do just to look good by my birthday, because I already look good. I just wanted to look better. So that's that. I'm pretty excited already, knowing that this is something I wanted to do for a while, and now I'm getting it done. But prior to the actual surgery, I will have a pre-op appointment that's scheduled for April 30th. I already forgot. The end of April. At the pre-op appointment, they're going to explain to me recovery, how I'm going to take care of myself, and whoever's going to take care of me, how they're going to help me take care of me, and basically give me a list of medications that I'm going to need to pick up prior, and a list of stuff that I can and cannot do. Stuff like, you know, you can't drive for, I think, like 2 weeks or something, and then you can't sit on your butt for a certain amount of time, like how to lay, everything like that. So pretty nervous, but also very excited. But I will definitely keep you guys updated. I will be recording for my pre-op and especially my surgery day, so stay tuned. Hi you guys, it's April 30th. I'm on my way to my pre-op. I'm on my way to my pre-op appointment with Dr. Kimberly Henry in Davis. I'm so excited. I think it's only gonna last like 30 minutes to an hour. We're really just gonna re-go over everything. She's gonna give me a packet with the night before instructions, the morning of instructions, aftercare instructions, a list of things to buy, as well as my prescriptions, my drugs that I'm gonna have to take, which I'm hoping that I only need to take them for the first couple of days. My pain tolerance is really high, especially since I had a C-section with my son, so I think I'll be okay. But super excited, like I can't believe I'm only a month away from having a booty. But yeah, I'm gonna try to get as much footage as inside. She's not like the biggest fan of cameras, but if anything, I will let you guys know how it goes. And there's like no traffic, so I'm actually getting there fairly fast. I'll probably actually be a little bit early and check in with her. And then as well as getting all the instructions today, typically with most surgeons, usually pay the rest of your balance off with the pre-op appointment. So I'm paying off the rest of my balance today of what I am going to owe for the total procedure. And then on top of that, anesthesia is like a separate cost because you don't pay the surgeon directly for the anesthesia. You pay like the anesthesiologist and then the company that they work through. And I'm actually not going to pay that until the day of surgery, just because they don't want to overcharge or undercharge you. So after the surgery is when they will actually charge you for that, and then you'll pay for that. So really up until the surgery, the only thing I'll have left is the anesthesia cost, which for my surgeon, and it's different for which for my surgeon, for every surgeon it's different, but for my surgeon it's $360 an hour for anesthesia. And BBL implants, they typically range anywhere from 3 to 5 hours, just depending on how much they need to pull out. So I imagine mine will probably be closer to 4 hours. So as if you can do the math, it'll be about $1,000 just for the anesthesia. But I'm about to take the exit, stop at Starbucks, get my coffee dose in, and then I will see you guys at the office. Got my coffee. Okay, you guys, so I just pulled up. And I'm just now gonna go inside. So I just got done filling out paperwork in that main little waiting room office that I just showed you guys, and now I'm just in here. I was actually in this room. Hi guys, just got home from my consultation. I actually haven't even looked in this little bag that they gave me, but basically once I got there, I went in the waiting room. She gave me that big old packet that I showed you guys with a bunch of questions, which I actually have a copy of it, so I'll go through it with you guys. And then they took me into that room that I also showed you guys with the little table. And one of the secretaries, she basically went over the checklist with me, as well as some of the most important risk factors and side effects. And then right after that, Dr. Henry came in the room and she talked to me one-on-one about any specific questions I had, which mainly were just in regards to how long I have to be sleeping on my stomach and how long I'm not allowed to drive, because I drive everywhere, like, so I need to get that all situated. But she was able to give me an answer for that. So here is a copy of the ginormous packet that they had me fill out. But okay, so there's two separate ones. So there's the first packet that in the beginning of my video, this is what they had me fill out and had me go over with the secretary in the room. So basically it's just, on the top it says my responsibilities before and after surgery. And then it's just a long checklist. It's before surgery checklist, the day before surgery checklist, and then the day of surgery checklist, the morning of. So some of the main things on here is making sure you have a responsible adult to take care of you up to 24 hours after your procedure. Preparing your surroundings. So basically, if you live in a house with stairs, she recommends that for the first 24 hours you don't even bother to try to go upstairs, or that you have someone who can physically carry you up the stairs, which I don't. So that's something that has to be situated, because it takes about a week for you to actually be able to walk after the procedure. 2 weeks before your procedure date, discontinue use of all blood thinning medications such as aspirin, ibuprofen, and any herbal supplements, vitamins such as vitamin E or fish oil, and absolutely no alcohol. I actually take vitamin vitamins, so I did ask about that because I'm on the depot shot for birth control, and I have to take it to resupply my body with calcium because it just drains the calcium out of my body. But those are actually okay. The main concern is the vitamin E and the fish oil. So if you're taking that and you find that you want to get surgery, make sure that's something to definitely bring up. The day before surgery, there's just 3 checks. Drink plenty of water, get a full night of rest, take your first Sinek pre-op pill. It says it's derived from Arnica, Montana, to help with swelling and bruising, and that is actually this right here. So then basically the night before my surgery, not only is the anesthesiologist going to call me to go through risk factors and my health history, but he's also going to tell me to take this. And then the day of surgery, it's a pretty long one. Mainly just has to do with the way you clean yourself. You're not supposed to wear any makeup, no lotion, no deodorant, no zip up or button up, basically just sweatpants or a long dress. She did recommend wearing a sundress because it's super hot outside. My original plan was to go to Walmart and get like a large or a size medium because I wear an extra small like sweatsuit. But I actually think what I'm going to do is just get like a super oversized like sundress or t-shirt. Just so I can be super comfortable, and then just wear some slides, because who do I need to look cute for? And then bring payment for anesthesiologist, because I said earlier you don't actually pay the anesthesiologist until that day, just depending on how long it takes. And then bring all of your medications with you the day of surgery. So I won't know my complete medication list until I get these labs done by Quest Diagnostics. It's 5 different labs that need to be done just to make sure that I am completely healthy. And then once all that comes back, and as well as a pregnancy test, because you should not be pregnant going under the knife. So I did consent to a pregnancy test, and I'm gonna have the pregnancy test taken along with those 5 different labs. And then once those come back, they'll actually be able to prescribe me the antibiotics and painkillers, etc. So I didn't realize it, but my son I didn't even realize it, but my son just woke up from a nap, and so he was kind of crying. So now here he is, all up in the mix as always. So they do recommend that you do get the labs done at least 2 weeks before your surgery date. So within the next week, I'm gonna go get those done, going to Quest. They do walk-ins, but I'll probably make an appointment because sometimes I know the walk-ins can take forever. And the 5, well, I don't know if you guys really care, but the 5 labs that they do is HCG, serum, quant, HIV, CBC, comp, metabolic panel, and I'm not seeing the 5th one. Maybe the 5th one is the pregnancy test. Is that good? Yeah? That's yummy? I chop, chop, chop. That's not for you. That's not for you. That's for Mama. That's not for you. That's for Mama. Yeah, you always want to be all up in the mix. Here, let's sit you right there. So after the checklist, it's just pre-op and post-op medication instructions. Ooh, okay, and then it actually has a list of what medications I'm going to be getting. So Vicodin, Norcos, Percocets. I'm playing. Antibiotics is Cipro, Valium, Medrol Duzpak, and Zofran, which I've actually had Zofran before when I was pregnant. I believe it's to keep nausea away. Yeah, keep nausea away. Because sometimes when I was pregnant, I'd have really bad nausea and migraines. So I remember a couple times having to take that. And I actually really didn't like it. So I might just stay away from that. And then they have Dietary Recommendations, which is actually something Dr. Henry went over with right before I left the pre-op appointment. She did say for 3 days to try to stick to a liquid diet, because when you get a BBL or butt implants, they do a little surgical incision right under your buttocks, very close to your butthole. So if you're pooping large stools or chunky stools, it's super, super important to either try to prevent that by having a liquid diet. Or just staying super, super clean. So if you're having like smaller liquidy stools, just basically cleaning the hell out of yourself afterwards. So she put for protein, concentrate on high protein foods, fruits and vegetables, stay away from carbs and starches as well as processed foods, and make sure you'll drink lots of water to ensure your body stays well hydrated, which is all pretty much like common sense stuff for just daily life. You're just talking my ear off, huh? Here, love bug. Lover, lover, lover bug, lover, lover, lover bug. She made us the power foods and food groups to help with healings. I'm sure I had the little lab sheet that I'm going to take to Quest within the next week. Love bug, here. Play with this. What is that? What is that? Oh, which by the way, in the little bag they gave me, which is this right here, which had, I already showed you guys this because for my consultation, she gave me one of these folders with her cute little Instagram page, and it had, basically a bunch of information inside of it. She gave me another one with the other stuff inside of it for this time. The cute little bag, some neck pill, and then I actually don't know what this is, but it's a little gift, but I'm going to open it at the very end. So she has strewn a little buttock implant post-op instructions. Basically talks about transportation, caretaker, no driving, says the amount of weeks that you shouldn't be driving, but then it has a little asterisk saying depending upon your healing, this time may be extended or reduced. And then this actually shows the butt cleaning that I was actually just talking about. It says hygiene most important, perianal cleaning. So keeping the anal area properly cleansed during the post-operative healing is essential to the successful outcome of the procedure. Improper or lack of cleansing in this area can cause bacteria, E. coli related infections. We require that the patient clean after all bowel movements, after gas. Oh, thank God I'm not super gassy, because I have some friends that they would have an issue because every 5 minutes they'd have to be, y'all know who you are. Drainage or bowel movement, it needs to be addressed immediately. Afterwards, make sure you always, and both parents always, wipe with antibacterial wipes away from your incision. Do this several times. Patients should be cleaning using wipes at least 4 to 5 times a day. Okay, and then so on to movement and activity restrictions. Why are you attacking me right now? No sexual intercourse of any kind, which I will not have a problem with. Do not bend at the waist. Do not excessively move legs while in bed. You can gently move or flex your feet to prevent blood clots. And then you must either be standing or lying down on your abdomen for these 6 weeks. So basically sleeping has to be on your stomach. No sitting, none of that. And then when Dr. Henry clears you to walk, generally after 1 to 2 weeks, you must take little baby steps. Taking long strides or walking fast will harm your incision or can cause infection. Regular use only a pad with no underwear. Won't have a problem with that. During your menstrual cycle, use only a pad with no underwear, no tampons. Wow. For all the excess blood and fat, like, well, not random, but little singular pages that are specifically for the medication. And then this second page talks about the drain that they're going to put in. For all the excess blood and fat. And those usually go, if you've seen other BBL videos or butt implant videos, those usually are like right in the back. But once I get those put in, I'll obviously show you guys how that looks like. And then there is like a whole booklet, which isn't even stapled, but it's just basically a lot of consents. It even talks about if you're unhappy with the procedure, that they'll be happy to fix it within a certain amount of time. You just might have fees, just like the anesthesia, but other than that, like, that's it. Medications to avoid: going to the operating room, general surgical risk, specific surgical risk, consent, HIV testing, consent for surgery, consent for use of photographs, medications, which that's all stuff that I signed previously. It's just copies of it. Post-operative care, as you heal, and then financial policies, which sounds pretty boring anyways. Actions, which is really just how you're gonna feel throughout the weeks. It says first week, low energy, emotional roller coasters. Second week, nitpicky. Welcome back, my little baby. So the last thing that they have in here is the emotional and physical reactions, which is really just how you're gonna feel throughout the weeks. It says first week, low energy, emotional roller coasters. Second week, nitpicky. Third week, show off. And then notice other reactions. And then the fourth week, joy. You look wonderful. Wow, but what about I love it? What's next? Nothing. And then it also shows the stages of the emotional roller coaster, and it just talks about how that's normal if you're feeling that type of way. There's a medication log, which is going to be super convenient. And then lastly, informed consent. And then that has just a like long list of the risks, disclaimers, possible reactions, and then obviously my signature. Beauty is pain, baby. Beauty is pain. So that's that. I'm gonna go ahead and open this now. I have no idea what it is. So she did not tell me. Oh, it's sweet candy. It's chocolate, baby. We love chocolate. He's juice. It's chocolate. It's chocolate, Lapa. You want chocolate? Chocolate, chocolate, chocolate. Chocolate, chocolate, chocolate. Chocolate, chocolate, chocolate. Man, I was trying to get them to clap. Okay, they are so sweet. So really, the only next steps are to get the labs from Quest Diagnostics, which I will do within the next week. Then I'm gonna actually order the BBL pillow on Amazon. Those are, I think, anywhere, I think they're raised around $100. I'll have to look again, but I'm gonna get that. I'm probably gonna buy some sheets that I'm not worried about getting dirty for my bed. Some outfits, like cheap sundresses from like Walmart. Oh, you are going in, aren't you? He's going in. Okay, all right, for sure. I'll probably get some cheap little outfits from Walmart, and then I think that's really it. I mean, as it gets closer, I'm obviously gonna get more stuff, but that's just stuff that I'll get within the next few weeks. I'm so excited. Oh, you are just messing the whole box up, baby. You can't be doing that. You are already eating this one, so you stick to this one, okay? You have to share with Mama. Sharing is caring, man. He obviously does not care about sharing. So yeah, sorry that I didn't get to like show really in the room or get to like film obviously the doctor actually talking to me. She's not really into all that. I'll try to, I'm gonna try to do it for the actual procedure, get a lot more footage from inside of there. But we'll see. If you guys have any questions, feel free to comment down below. And wish me luck. I will see y'all in 4 weeks.